Hi everyone, welcome. My name is Marlena Holden and I work at University Health Services. I'm excited for today's live question and answer session. We received questions from international students who submitted questions before, and additional questions can be submitted at the link below. I would like to thank our colleagues at McBurney Disability Center for providing captioning for today's discussion. You can find links below for live captioning. Now, let me introduce our presenters. Jake Baggett is the Associate Vice Chancellor and Executive Director of University Health Services. He provides leadership for departments within University Health Services and oversight for recreational sports. Jake Baggett has more than 35 years of experience in student health and well-being and student affairs. He also completed a 22-year military career in the U.S. Army and Army National Guard, retiring at the rank of First Sergeant in 2003. We also have Dr. Jim Conway, a professor of pediatrics at the UW School of Medicine and Public Health, and a UW Health pediatric infectious disease physician and medical director of the UW Health Immunization Program. Dr. Conway works both domestically and globally with programs designed to improve the lives of children. He's been involved with long-term field programs in Thailand, Kenya, and Ethiopia, and he's also on the Master of Public Health faculty at UW-Madison. We've asked Jake and Dr. Conway to be with us today to answer specific and frequently asked health and safety questions from our international population. Before we get started, I want to welcome each of you, the students who've chosen UW-Madison as your future place to work, learn, and play for the next few years. Whether you've arrived in Madison recently or about to start your journey here or been here for years, please know that everyone on campus is excited to have you here. Your contributions and talents are part of what makes UW-Madison a well-regarded institution. As a reminder, we've been accepting questions through a link below. You'll see the link below to submit questions for more than a week and are also able to take live questions now. If you have a question, please submit one at the link displayed below. I want us to spend as much time answering questions today as possible, so let's dive in. I'm going to start with some vaccine questions for Dr. Conway. Dr. Conway, some of our students are coming to the States with no vaccination record. Maybe they have one vaccine like Sinopharm, or maybe they have a mixed vaccine series like Sinovac and Sinopharm. Are they protected?
That's a good question. So I think what the best we would be able to say is they may be partially protected. And that's why the CDC has established guidelines for people that are immunized outside the country, that they can receive a full series of an FDA-approved vaccine series here if they either did not receive a WHO-approved series and did not complete the full series. So there are currently, WHO has authorized by emergency use 6 vaccines: the Pfizer vaccine, the Janssen vaccine, the Johnson & Johnson, and the Moderna vaccines that are all FDA authorized here in the United States. In addition, WHO has also authorized the AstraZeneca Oxford vaccine, the Sinopharm vaccine and the Sinovac CoronaVac COVID-19 vaccine. So those 3 WHO approved vaccines, if a person received a full series and is considered fully immunized, they do not need to be immunized again. So it's only for people that have had an incomplete series, don't know what they got, don't know if they got the full series, then we would certainly offer them to be able to complete a full series here in the US with one of the FDA approved vaccines.
Thank you, Dr. Conway. This is a question that has come in, is that there's interest in receiving an mRNA vaccine once they're on campus. Would they be eligible to do so?
So if they have not received an mRNA vaccine previously, and since those are the only approved vaccines here in the United States, they would be allowed to do so. I think that they would need to think about it very carefully because there's very little data on having received a full series of another vaccine and then receiving an mRNA vaccine separately. So I think that would be the big consideration, is making sure that they were comfortable and understood the risks and the side effects. Obviously, these are very immunogenic, these are very immune stimulating vaccines, and that immune stimulation is really what leads to the side effects. And so I think they would just need to make sure they had a good discussion with a provider and understood the benefits and the risks of doing that. There certainly is evidence for all of the vaccines having some waning of their immunity. And so obviously we're in active discussions here in the United States and elsewhere about starting in with booster programs. And so certainly there is going to be some discussion about offering additional doses of vaccines, whether people have initially started with one of the FDA-approved vaccines or whether they've been immunized in some other place. So a lot of this is still to be determined. But yes, in some of those circumstances, an mRNA vaccine would be acceptable.
Thank you, Dr. Conway. You mentioned additional doses. That is something that campus is having active conversations about right now, and we hope to have an answer soon, and we will communicate it broadly with the campus, providing additional doses to students on campus. So we look to have an answer for that in the coming weeks. So Dr. Conway, another question. This is one that was submitted earlier in the week, and I'm going to read it directly. International students who did not get vaccinated in their home country will need 1 month to finish either 2 doses of Moderna or Pfizer. How can we be safe against COVID in September, as we may only have 1 dose of the vaccine at this time?
Yeah, I think everybody needs to think about the other things they're doing to mitigate risk. So these vaccines are all, very good and very effective at doing what we want them to do, which is preventing severe disease, hospitalization, and death. But they do still certainly permit and allow people to get mild infections and potentially transmit those infections. So just the existence of being vaccinated, even for people that are fully vaccinated, still does need to, all those people need to really consider what else they're going to do to mitigate their risk. That's the reason that we've endorsed masking within all buildings on campus going forward, and we continue to recommend that people do all the things we've been doing through pandemic. If people feel any signs or symptoms of illness, they need to stay home. People need to be very cautious about hand hygiene, avoiding indoor settings with unmasked individuals in closed settings, trying to keep distance between people. We had hoped that this was starting to ease up, but this is clear that we are now in a 4th wave of this. And so regardless of what your immunization status, unvaccinated, partially vaccinated, or fully vaccinated, everybody still needs to stick together and continue to do all these mitigation activities that have actually been so successful.
Thank you, Dr. Conway. There's a live question that just came in. Before I read that, I do want to just reemphasize that UHS is offering no-cost vaccines to those who have not yet been vaccinated. And Dr. Conway, you mentioned speaking to a provider about what your vaccine series may mean. You can reach out to UHS at uhs.wisc.edu. That's our main website. Our main phone number is also 608-265-5600. When you go to the UHS website, you're able to send a secure message to a provider, and then you'll be able to connect with them with some of those questions. Dr. Conway, I'm going to read this live question. I'm going to paraphrase a tiny bit. People are hoping they can hear a little bit more about the circumstances around where an international student might be recommended a full mRNA series. So if you can speak to that recommendation. And if we have situations where it wouldn't be recommended a full mRNA series, what would you continue to monitor? What would you recommend that they continue to monitor?
So for the first part of the question, for people that would be recommended to get a full mRNA series, that would be people that either had completed a vaccine series that was not one of the WHO 6 vaccines that I already mentioned that had already been approved. So there are a lot of other vaccines. There's vaccines in all different stages of development. People have been enrolled in different vaccine trials all over the world, and many vaccines are being offered that have not been WHO approved. So for people that received those vaccines, under those circumstances, they certainly are entitled to a full mRNA series. Similarly, if people have only received a partial series of a vaccine outside the country that's not approved here in the US, such as the Sinopharm, the Sinovac, and the AstraZeneca vaccine, those people would also be entitled to a full mRNA series. Those are really the two groups that I would think that even if they've had some vaccines outside the country, should strongly consider getting one of the 3 approved vaccines here in the United States. The other thing I should make sure to mention is that people sort of keep lumping Pfizer and Moderna in one category and the Janssen vaccine in another. And I think it's important for people to recognize that all 3 of these vaccines actually work exactly the same. While the Janssen vaccine currently is only a single dose, it's a DNA vaccine that actually then your body makes into mRNA, and then it goes down that very same pathway. So all 3 of those vaccines that are approved here in the United States under emergency use authorization should basically be considered equivalent as far as how they work. So hopefully that helps answer, because the people that may have only received a partial vaccine or an unapproved vaccine would be entitled to any of the 3 existing vaccines here in the US, Moderna, Pfizer, or Janssen, not just the mRNA vaccines. Can you then give me the other part of the question again?
Yeah, so if folks are not fully vaccinated with the mRNA series, what should they look for? What should they monitor? Are there any concerns that you might suggest or recommend?
Well, we should all be constantly monitoring ourselves for any signs of respiratory illness or any of the 20 different symptoms that potentially mark the possibility that somebody actually has a SARS-CoV-2 infection. So sudden loss of taste and smell, runny nose, cough, aches, fever, headache, all those things that we've all been thinking about throughout this entire pandemic. Everybody should be monitoring those symptoms constantly, regardless of their vaccination status. And again, we strongly ask everyone that if anybody has any symptoms of a respiratory illness this particular year, it's extraordinarily important to not be a hero and still muscle through and go to work and school, but to really take time away so that you're not spreading these things to others. And whether it's SARS-CoV-2 or influenza or RSV or some other respiratory virus, we're all in this together, and we all really need to work hard at trying to protect each other. And part of that is really taking personal responsibility, monitoring your own body, monitoring your own symptoms. And if you have anything that resembles a respiratory viral illness, please stay home and protect others.
Thank you, Dr. Conway. This is very helpful information. I want to switch over to Jake to answer a few questions. Jake, I'd like to ask you how vaccination impacts students' ability to be on campus. For example, earlier this month, campus made changes to masking guidelines. Could you please talk through that update a little bit?
Sure, and thank you for that question. First of all, on an individual basis, folks who've chosen to get vaccinated and been able to complete that should have a lot of confidence in their level of protection. That is the single most important thing that you can do. So you should have a lot of confidence in the vaccine. We did change earlier this month. I made a decision to add an additional layer of protection by adding a face mask requirement, and we did that just to, first of all, to further protect each other, and also to provide a layer of protection for those in our community who aren't yet eligible for the vaccine, young children in particular. And so that is something that we can do in addition to the vaccination itself, to just add additional layer of protection. And then those who aren't who haven't been able to get vaccinated, or for some reason have chosen not to do that, then there is a testing requirement that we've established. And so folks that aren't vaccinated will be expected to get tested once a week on a regular basis to help identify and address any infections that might develop.
Thank you. So we talked briefly through the masking mandate. Dr. Conway, can you please speak more to the role that masks are playing in preventing the spread of COVID-19?
Sure. I mean, obviously, this has been a source of some confusion, at least here in the US, as this has been messaged by the public health authorities. There's really 2 reasons that masks are useful in these kinds of outbreaks. One is to protect everybody from an individual who is infected. As we all cough, sneeze, laugh, yell, we generate what many people call mouth rain. And so those droplets and those aerosol droplets that we generate are then infectious if we are carrying and shedding the SARS-CoV-2 virus. And so masks are extraordinarily effective at preventing people from then disseminating those viruses into their environment and infecting other people. The secondary gain, and I think this is where it got a little confusing, is that they only partially protect the wearer of the mask, but they do offer at least some protection by wearing them. Unless you're wearing an N95 mask that actually filters out all the air that you're breathing, both cloth masks and procedure masks, what we call surgical masks like this, really do have enough gaps around them that they still do allow some air to enter. And so there is still some ability to inhale droplets of aerosol that other people have generated. But they do at least provide some protection, especially if somebody coughs or sneezes or yells directly in your face. And they also keep our hands away from our mouths. And so I think one of the things that we know with some respiratory illnesses is that they can be transmitted by droplets where somebody sneezes or coughs on a surface. You touch it with your hands and then touch your own face, and you can actually infect yourself. And so the masks offer some benefit to the wearer, but primarily the reason for wearing masks is that they protect when people may be shedding virus. And although many people that have virus and are shedding are ill and have symptoms, we've discovered that there are some people who we call asymptomatic. They really have very minimal symptoms or may not be aware of their symptoms. They may not be quite as sick yet to have generated symptoms, and yet they still could be shedding virus. And so that's why these masks are so important universally for all of us on campus, to just keep protecting each other and protecting people from getting infected so that we can continue to stay open and continue to function the way we want to.
Thank you. That's very helpful. I want to go back to a little bit about vaccines and being tested. Jake, you mentioned that there's still people who might be coming to campus who have not yet chosen or had an opportunity to get vaccinated, and now's the time. It's never too late. But if someone comes to campus and they get vaccinated as soon as they arrive, will they still need to test?
Yes, that's a great question. First of all, thank you for taking that step, and we just encourage you to do that as early as possible upon your arrival. But while you have started the vaccine and will start to have some level of immunity growing, until you completed the series and have had 14 days from the second dose of the vaccine, you're not fully protected. You're not getting the full benefit of the vaccine. So, for that period of time, you'll still need to continue to test. So 2 weeks after your last vaccination dose, then at that point, you'll be considered fully vaccinated and no longer will be required to participate in the testing. However, what we want you to do is to continue to self-monitor for symptoms. And if you develop those even after you're fully vaccinated, we just ask you to please get tested, just in case you do experience some level of breakthrough.
Thank you. What about students who might have questions about their vaccine status? Where can they go to get that information or have their questions answered?
So the UHS team, and I think you shared some contact information earlier, are here and prepared to help you work through those questions. Some of these will be individual based on your individual circumstances, and we're happy to help you with that. But yeah, contact your UHS provider. Use the email that Marlene has shared. UHS.wisc.edu is the website. There's a lot of information there as well. There's a number of ways for you to get your questions answered.
Thank you. And just to emphasize, at that website, you can look for the portal called My UHS. That's the electronic health record. There you'll be able to submit a secure message to a provider. UHS also has an app available in the Apple and Google Play stores called My UHS. That's shown on the screen right now. You can download it. And again, that's the place where you can schedule your testing, submit your COVID vaccination records, connect with a provider, and much more. So take a look at that. So Dr. Conway, the residence halls are going to start having folks arrive on Sunday, and people are preparing to travel from all over the world. For those that are preparing to travel to the United States, what guidance can you share with them?
Yeah, good question, and obviously a period of some anxiety for people, because obviously we've been trying to keep people from clustering in large groups in indoor areas, and obviously that's the definition of an airplane. And so I think people need to think about a few things. One is understanding that airplanes actually turn out to be reasonably safe, that the amount of air circulation and filtration on airplanes has been ramped up pretty universally by all the airline industry. And so there's actually been very few cases of transmission on airplanes, providing, again, that airplanes are filled with people that are masking. And so that's part of the reason that the transportation authorities here in the United States have extended the guideline that all travelers on public transportation, buses, airplanes, etc., are all masked for the entire duration of that time period. The risk at times really turn out to be in transit, in airports and other areas where people are a little bit more freewheeling with their activities, and especially when people are in areas that are eating and drinking and people are dropping their masks. That's really where most of your risk and exposure happens. So we do recommend that all travelers stay masked as much as possible throughout the entire duration of their travel, to have some hand gel with them and perform good hand hygiene routinely. Many travelers like to bring some sort of antiseptic, antibacterial wipes with them and wipe down their immediate proximity on the airplane, and if they're going to be sitting for a long time in one particular area of the airport. And obviously trying to sit farther away from people as much as possible is really critical. So it's really trying to manage your environment is what we talk about, is mitigating your risk by managing your environment, keeping yourself to yourself, trying to stay away from other people as much as possible. But really the masking throughout the entire duration, this is where the masking does offer some protection for the wearer. People may want to consider additional masking guides, including either double masking, wearing some kind of surgical or procedural mask like this, combined then with some sort of cloth mask like this over it, which does give some additional benefit, or getting hold of a KN95 or an N95 more tight-fitting mask that actually does offer better air filtration. I think those are the most important things as people are in the process of traveling.
Thank you. So a well-fitting mask, you're saying, is important. You mentioned, antibacterial wipes. Is that something you would recommend to folks who are traveling, to wipe down their seats or their areas if they might be waiting in airports?
Yeah, I certainly think it's worthwhile. I certainly have had to travel some during the pandemic and have been very cautious and careful about managing my environment. I think the planes, certainly the airlines, are trying to do as good a job as they can with careful cleaning, but obviously they don't probably get every tray and every pocket and every arm of every seat. And so I think maintaining some cleanliness there on your own is at least reassuring. And similarly, if you're going to be plopped somewhere in an airport for some hours of time, killing time waiting for a flight, again, I try to find a gate that has no flights departing from it for some hours, so I can have most of the gate to myself. But again, there's been people coming and going from that space throughout the time that the airport's been open. And so just being able to reassure myself that this is something reasonable and a safe place to be. And I've actually done this for many, many decades of travel, is constantly trying to maintain the cleanliness of my surroundings just to prevent myself from getting illnesses, whether it's SARS-CoV-2 or any number of other infectious illnesses that people can get while they travel.
Thank you, Dr. Conway. I would like to just also add that I've been wiping down airline seats for a number of years, and my family used to give me so funny looks, and now I feel redeemed. So I can say that not only has recent evidence come out about this, but I heard from a doctor who travels internationally frequently that that's a great idea. So thank you for validating my past experiences and practices. I just want to remind folks that we are accepting live questions. There's a link below where you can submit live questions. That's go.wisc.edu/international Q&A. We're answering questions that have been submitted from international students this past week, and we're also able to accept those live questions now. So feel free to go to that link below and submit them, and we will answer them. Dr. Conway, I want to ask a couple other questions for you. Well, I'm going to be asking you questions throughout this time as well. But what about when students arrive to the U.S.? Can you speak to what they need to do about quarantine?
Yeah, this is a moving target, and I encourage people to sort of keep up with the most recent posted updates. And a lot of this has really been changing as we learn more and experience more with the Delta variant, which is really now essentially the predominant variant that's circulating in most areas of the world. It really does depend on your vaccination status, but when you arrive in the United States, you're basically asked to self-quarantine for 7 to 10 days and to be tested sometime between days 3 and 5 after you've traveled. And so that testing, Jake and his team can certainly help explain how to arrange to get that testing done. And there's certainly for other family members that have traveled with students and their families coming into the area, Public Health Madison-Dane County has plenty of opportunities to be tested as well. And so after the quarantine period of 7 to 10 days, and really what that quarantine is about is that this virus has a variable incubation period after people are infected, where it can incubate within your body and only start to develop shedding and symptoms after some time. Early on in the pandemic, we experienced some confusion. And so the original quarantine guidelines were up to 14 days. It's now pretty clear that most people that are going to get ill with this infection are going to develop their symptoms between days 5 and 10 after they've been in contact with somebody who was contagious. And so that's the reason that the quarantine times have been basically shortened to 7 to 10 days with a test being done on day 3 to 5. So after the quarantine and after a negative test, if you don't have any symptoms, then people can be released from quarantine and then resume their regular activities. And certainly if they're unvaccinated, one of the first things we'd ask them to do is then go get vaccinated at UHS as quickly as possible. Let me just throw in one other thing, just because these terms get interchanged and confusing. And I think if we use them consistently, I think people will understand them better. Quarantine is really a time period after you've been exposed potentially, where you're waiting to see if you actually develop symptoms. If you develop symptoms, or if you test positive for SARS-CoV-2, then you go into isolation. And isolation is a very strict period of time where you're at high risk that you could actually transmit the infection to others. And so you really do need to comply with those isolation guidelines. Quarantine is the one that I think has been kind of gradually changing. It was shrunk, it's kind of expanded a little bit again. So that's the one that moves around a little bit depending on sort of what the virus is doing. But the isolation is very consistent after people are sick, that they're asked to stay in isolation for a full 10 days and avoid any exposure or any contact with others.
Thank you, Dr. Conway. And we have answers to some of these questions on a COVID response website. The URL for that is go.wisc.edu. On the upper tab, you can find, it says frequently asked questions, and there we detail more information about quarantine and isolation. So Dr. Conway, you mentioned testing once you come to campus, and I'm going to have Jake answer a couple of questions about that. Jake, first, Jake, I'm going to have you speak to quarantine a little bit about what happens when students arrive. Jake, can you please speak to quarantine options for students who arrive and are going to be living in university housing?
Yeah, thank you. I appreciate that. So the students that live in our on-campus residence halls at university housing, we have already prepared spaces for the possibility that you might test positive during your time here, or that you might be identified as somebody who needs to be quarantined, to make sure that you don't develop a positive case. And so in those cases, we have rooms set aside to support you during that period of time. And so if you're living off campus, you'll be contacted by a contact tracer as part of the UHS team, who then will kind of guide you through how to manage that if you're living off campus. For all those living on campus, though, we have options already established to support you during that period of time.
Thank you. And how would a student learn about this? You said that if they live off campus, they might be contacted by what's called a contact tracer, so that somebody either working with the local public health department or university health services. What about if they live in housing? How will they know what to do?
So first of all, you're going to get notified of your test results through the MyUHS. And just again, encourage you to download that MyUHS app onto your phone. That's a way for you to quickly log in and get any test results that you're expecting. You also, if you live in a residence hall, housing will also be aware that you might need to be quarantined and isolated, and they'll support you in that as well. And if you don't have a mobile device that you can load the app onto, you can certainly do that through the internet, through the web, and get that same level of access.
Thank you. And Jake mentioned that there is an app for MyUHS, which is our electronic health record. There was a link before that. There's a link posted, and there's an image put on the screen right now where you're able to download this app in the Google Play Store or in the Apple Store. There at the MyUHS app, you're able to make appointments for testing, to get a vaccine. You can message a provider there as well. In addition to finding information on the app, you would get what's called a secure message in your email. So people would be contacting you with test results and information in multiple ways. So let's now go to testing a little bit. Jake, can you please share information about testing at UW-Madison?
First of all, we've established some testing sites here on campus, and that information will also be available on the website, where you can go to get tested. You will need to schedule an appointment for that. It's on an appointment basis. And so there will be, I think we have 3 sites already identified, and the schedule will be available again through the app or through your portal at My UHS, and you can see, you know, what are the available appointment times for you, and just encourage you to do that as soon as you're aware that you need to be tested, and in particular upon arrival during that 3 to 5 day period. And then if you're contacted by a contact tracer through UHS or through the local public health department as somebody who needs to be quarantined or isolated, you'll get instructions about that as well. And then the other thing to keep in mind is that even though we have regular weekly testing requirements established, that we'll use the same process, we also ask you to continue to self-monitor to make sure that if any even mild symptoms develop, we ask you to go ahead and get tested just to make sure that you don't carry an infection that you might not be aware of.
Thank you. And, you know, in addition to the links that were shared below, we will be adding links and some helpful information from the CDC in the YouTube description after this. So we'll be able to have that information. I want to also emphasize that testing is no cost for students. So just to emphasize that part. And Jay, can you speak to how often students should test, or which students again should test?
So the students that are required to test are those who have not been vaccinated or have yet to complete the vaccination series in that 2-week period after their second dose. So those folks are required to test once a week at one of the on-campus testing sites. It is necessary for you to use the testing sites here on campus. Outside testing won't satisfy that weekly testing requirement, so just keep that in mind as well. So make those appointments early as well. And then if you are identified as a close contact, we'll ask you to recommend that you get tested as well during that quarantine period. Can you please tell what type of test we offer? Sure. We offer the PCR test, which is really the state-of-the-art test. It's the one that gets the most reliable results. It's the one that we have a lot of confidence in. There are other tests that are available, but this is the one that we know is going to give us the best result and most reliable, and then we can make the best decisions about how to support you in that. Thank you. Speaking of the PCR test, Dr. Conway, I want to ask you a follow-up question about that. Do you feel like that's a good test for travel requirements?
Yeah, PCR is really the gold standard for all of the testing, and so we're very pleased that UW has been able to provide PCR testing reliably to all of our staff, faculty, and students. There are a number of other tests that are out there. The antigen tests are the ones that are easily available and available for home testing, but they're really quite variable as far as the results. They sometimes lack sensitivity. They may not pick up people that are actually early in being infected, and they may sometimes give false positive results as well. So in the healthcare side of campus, we don't even accept them as being definitive and always end up repeating it with a PCR when somebody comes in either with a negative or positive, depending on the circumstances. And some countries are being more and more particular about the type of testing that they will allow to be used for entry into their country. And so we strongly recommend that students primarily use PCR, especially because it's been so readily available through UHS and through the campus.
Thank you, Dr. Conway. I want to have a follow-up question for you, or a couple follow-up questions for you. There's been a lot of discussion that many of us were free from cold and flu season last year due to staying at home and wearing masks. You spoke about how effective masks are in not spreading viruses. But as we think about this cold and flu season, and as the world has opened up again, how can we start to think about what a cold and flu season might look like, or allergies? How can we distinguish what could be COVID symptoms from allergies or the cold or flu?
Yeah, I guess I'll answer that in two ways. But first of all, it's clearly going to be chaos in the respiratory viral patterns of things. What we did see is, the combination of masking, safer at home, and then lack of international travel, which is really, much of how different viruses get introduced into different areas of the world. Flu circulates year-round, but it circulates primarily in different areas of the world depending on the seasons. And so what we've seen now as restrictions have lifted in many areas, is unpredictable outbreaks of disease that are usually much more predictable. So for instance, RSV, respiratory syncytial virus, is a virus that very reliably circulates in Wisconsin, for instance, usually starting in November and circulating into May on some years, but usually kind of dies out in March or April. It's a high-risk disease for people with underlying illness, especially premature babies with incompletely formed lungs. And it's very reliable when it happens. Lo and behold, this actually started showing up early summer this year as society started opening up, and RSV rates are at the record levels really now in August of this year compared to any other year that I can recall in the last 20 or 30 years. So I think what we're going to see is that we're going to see viruses that have been dormant and large portions of the population that never got their natural immunity from being exposed to those viruses being vulnerable to them, as well as a lot of unpredictable travel as people are moving in ways that are uncommon. And so I do think we're going to see outbreaks of viral diseases that are going to be off cycle from when we typically see them. I think we certainly proved that with masking and people being very careful about their own secretions and controlling their own mouth rain and keeping their hands away from their own faces, that they actually can and will diminish their own incidence of these kinds of illnesses. And so I think one of the things we're hoping is that many people will continue to adapt and use many of those same practices and continue to practice careful hand hygiene. Will continue to stay home if they're sick and not feeling well. Will continue to give distance between themselves and avoid unmasking in largely populated indoor settings. So we're hopeful that with all of these other mitigation things that are being done primarily for COVID-19, that we may be able to tamp down the respiratory viral season. The other thing, obviously, is then asking people to get a flu shot in at least one way of trying to help control that particular disease. And when you ask about sort of the overlap of symptoms, influenza and SARS-CoV-2 are really the two that overlap most closely. They both have headache, fever, achiness, cough, runny nose that go along with them. And so those two in many ways are indistinguishable. And so anything we can do to protect ourselves by getting vaccinated against both of those diseases really will help, I think, alleviate people's anxiety. There's a lot of other respiratory viruses. There's common colds and parainfluenza and many others that may just give people mild runny nose, and that can overlap with allergies. And so I think with people with known allergies, that they should be readily taking an antihistamine or some sort of symptomatic relief to try to alleviate those symptoms. And if those symptoms don't improve the way they usually do, then maybe they are more than just allergies. And we would ask people to err on the side of being more cautious this year. And so any kind of respiratory symptoms should really make people pause and think about whether they think it's the right thing to go and expose other people to themselves.
Thank you. Oh, Jake, good.
Sure, I would add to that, and thank you, Jim. That was very helpful for people to understand the importance of the flu and the vaccine, and that's something that UW-Madison has been very committed to for many years. UHS holds a flu clinic every fall, and this year is even more important than it's ever been. The second most important vaccination you could probably get this year is the flu vaccine, and so that's going to be offered through UHS starting on September 13th and through the balance of the month of October. So just really encourage you to go ahead and take full advantage of that. It's a no-cost option, just like the COVID-19 vaccines. There's no out-of-pocket expense for either one of those. So please take advantage of that while you're here, just to add another layer of protection and to maybe eliminate the possibility of you contracting flu and potentially sharing it with others as well.
Thank you, Jake. I think one of the things I'm really proud of is that UW-Madison often has one of the most highly vaccinated against flu populations against the flu. And Dr. Conway's applauding that way. I think in large part because we offer this at no cost, but we look to continue to increase that number even more. So again, beginning September 13th, UHS will offer no-cost vaccines to students. So stay tuned for that information. If you're just joining us now, welcome. As a reminder, you can submit your questions to go.wisc.edu/international-Q&A. I'd again like to thank the McBurney Disability Resource Center for providing captions for today's Q&A. Again, we're answering submitted and live questions from international students about what they can expect this fall at UW-Madison. Again, we're joined by Executive Director of UHS, Jake Baggett, and Dr. Jim Conway from UW-Madison School of Medicine and Public Health, and also at UW Health. Jake, I'm going to transition to you about some more of these campus expectations. And can you help us, or can you please talk through, can professors or classmates ask about a student's vaccination status?
That's a great question. Thank you. And that's something that we all are thinking about, who around us are vaccinated. But that is your information to share it as you feel comfortable doing it. Faculty or staff or other students shouldn't be asking you for that information, and you're not required to share that. Now, you may choose to do that, but again, that's your information, so you shouldn't be expected to do that. And so hopefully that's not an experience that you would have.
Thanks, Jake. Thanks, Jake. I know every year I like to tell people that I got a flu vaccine, just if I can convince one more person to get that important vaccine, it makes a difference. And I've really appreciated telling people that I've been vaccinated against COVID as well. Dr. Conway, I have two questions for you. One is a live question that's come in, and one is a submitted question. The live question is, this person is hoping you can share the specific names again of the COVID-19 vaccines that are authorized here in the United States, and the name of the flu vaccine, the names of the vaccines. Could you please share those?
Sure. So the authorized vaccines here in the United States are the Moderna and Pfizer mRNA vaccines, and then the Janssen or Johnson & Johnson was developed by Janssen, and then they were bought by Johnson & Johnson. So you'll hear people use those interchangeably, and that's a DNA vaccine that basically codes for mRNA and works exactly the same way. Jake will have to answer specifically which vaccines are currently available on the UW campus. So I'll punt that one over to him.
Sure. And currently we have a great deal of availability of both the Moderna and the Pfizer vaccine. We have had in the past Johnson & Johnson available to us as well, and that may become available right now. But the Moderna and the Pfizer vaccines are the ones that we have plenty of supply on to meet any of your needs when you arrive on campus.
Yeah, and then as far as influenza vaccines, there are 20 different influenza vaccines on the market. All of the U.S. vaccines have become what we call quadrivalent vaccines. So they have 2 different strains of influenza A and 2 different strains of influenza B that are the vaccine strains that are predicted to likely be circulating. There are still some vaccines around the world that are only trivalent, that include just 2 types of influenza A and 1 type of influenza B. But here in the U.S., almost every vaccine currently available, and certainly everything that would be available for students, are going to be quadrivalent vaccines. So those are the best, most protective vaccines, and they all basically work the same and just have different names based on different companies.
Thank you, Dr. Conway. And yes, UHS has been providing quadrivalent vaccines. I don't have the specific name of that, but again, beginning September 13th, we'll be providing those vaccines. If you have questions about your vaccination status, I just want to remind people that they can look in the electronic health record called MyUHS if you've been established with UW-Madison and have uploaded your vaccine status. There you can even see your flu vaccine status. So for example, I'm able to see my past flu vaccine status as well there. Dr. Conway, this was a submitted question. I'm going to read it actually out loud. This is reading it as it was submitted. The question reads, COVID is still serious in both the US and my country, China, and air travel feels dangerous. My parents are worried. Delta is more dangerous, and some cities in my country are restricting movement outside, which makes travel difficult to predict. Dr. Conway, is there any advice or thoughts you can offer to the student?
Yeah, I mean, I think it's appropriately worrying to see what Delta has done, especially in communities and societies that have completely opened up and gone back to essentially normal functioning. This is a highly transmissible, highly contagious virus that can move very quickly and take advantage of primarily people with underlying medical conditions, but can certainly infect healthy people as well. And so I think that being cautious and being careful is absolutely merited. And so I certainly understand that everybody and their parents are justifiably worried. The best news that we have, though, is that we have very good and very strongly worked out ways of controlling and mitigating this risk. And so being vaccinated and minding your own particular space, masking appropriately, all of these things are actually working quite effectively. And for people that do these things reliably, there's really a very careful and safe way to navigate travel and get from point A to point B where they need to be. So we certainly understand people's worries, and we find that the people that are worried are often the ones that are the most careful. And so I encourage people to embrace that worry and to really, develop your own protocols. Some students have told me that they've even practiced for a few days before traveling and have actually worn masks around the house all day just to get used to it and to not be bothered by it. And so being prepared and having all your things in order and being conscious of your environment is really the best way that you can manage those anxieties and those worries.
Thank you, Dr. Conway. And I would say, now that UW-Madison has the masking requirement indoors, I think a lot of us have had more practice with that. And I think too, our medical providers and staff who've been at UHS the entire time, never worked from home, who've been wearing masks all day for, 18 months. So there are a lot of people who've had a chance to practice this and can report that you can go throughout your day, masked and still work effectively. And I imagine you do the same too in your practice, Dr. Conway. So I have another submitted question, and this one's for you, Jake. A student wrote in and they are wondering if international students, including graduate and professional students, need insurance to use UHS services, even if for just the vaccine. And they're also hoping you can speak to the Student Health Insurance Plan, also known as SHIP.
That's a great question. First, the services that are available through UHS don't require an insurance plan. That's all part of the fees that are part of your tuition and fees to provide access to those really important services. I just want to reiterate that the COVID vaccine and the flu vaccine will be available to students and the rest of our campus community at no cost. So there's no out-of-pocket costs associated with either one of those. The insurance plan that's sponsored by the university is designed to provide coverage for those who don't have their own health insurance that will work well in this country. And so it's a very reasonably priced product. It provides coverage for services like the hospitalization, the emergency room, specialty care that's outside of what's available on campus, and surgical care and things like that. So it really adds the access to those important services. Much of your care that you're likely to need can be obtained through UHS, and again, there's no cost associated with that. But if you do need some of those other services, that's why the health insurance is so important for you to have.
Thanks, Jake. And I just want to reiterate, no cost, because students pay for these services through their tuition and fees. And I just want to give a brief sense of the scope of what UHS provides. In a typical year, we provide more than 100,000 patient visits. A lot of that is through primary care, where we're able to address, any major concern that folks have. We also have no-cost mental health services, and we also provide primary prevention services at UHS. So we really offer a broad, integrated care for students. And, speaking of broad care and related to health, we have a robust recreation facility here. And this was one of the submitted questions that I'm also going to give to you, Jake, is can international students use the recreation facilities, and do they have to pay for them?
Oh, again, great question. We have tremendous recreation facilities. We have a brand new center that opened last fall that I would just encourage you to take full advantage of. And again, those opportunities to engage and use those facilities and services are also included as a part of your segregated fees that you pay. So there's no additional fee for that. You're actually already eligible for that as just by being a student and paying your tuition and fees. So we encourage you to take full advantage of those opportunities. There's a great facilities and a great staff and great programs available to you.
Thanks, Jake. And if you visit UHS, you'll be in very close proximity to the new Nicholas Recreation facility, which is fantastic. So I highly recommend students check that out once they're on campus. Dr. Conway, this is a follow-up question from a student about if they choose to exercise or do activities outside. Should they be concerned? Do you recommend that maybe they mask if they choose to go for a run or do other types of physical activity outside?
Yeah, it's a good question. I mean, I think we early on had people masking pretty much everywhere because we really needed to understand how and where this virus was transmitted. I think we've learned a lot about it, and it turns out that in most circumstances where people are outdoors, the risk of transmission is really quite low between the combination of wind and some ultraviolet light from sunlight. The outdoors is really probably the safest place to be. And so I think that in general, for people that are especially doing individual type workouts, I think unmasking while outdoors is very reasonable. I think the one time to consider masking during recreation outdoors is when people are going to be in very close proximity with people that they don't quite know exactly what their status is. And so there is some risk, I think, in being in very close proximity with large groups of people that come from many different living situations and households. So I think there could be some circumstances with some sort of group sports activities where people are in close contact that they may want to consider masking. But I think in general, for most of the types of things you're talking about, unmasking while outdoors and working out is reasonable.
Thanks, Dr. Conway. We have one more submitted question, and then after you answer that one, I'm going to actually turn to you and Jake to give some final thoughts. But Dr. Conway, we received this question in many different forms and formats. Students concerned about attending in-person instruction safe this fall. Could you please give some of your thoughts about what it'll be like to attend in-person classes at UW-Madison this fall?
Sure, wonderful question, and obviously probably the most important one that most of us on campus have been thinking about and talking about for many months now. I think we all value the opportunity to be together, and there really is something special about being in person with people where we can share ideas and exchange our own thoughts and really learn together. And so I think everybody's been striving to do everything we can to get into that setting again. It is certainly fits into the risk categories of large groups of people indoors. And that's one of the reasons that we've been so careful about trying to set things up in a way that really protects everybody. And that includes trying to make vaccines available for everybody and encouraging people that vaccination is by far the most important thing that we can all do, but adding in secondary mitigation to minimize that risk by having people wear masks while they're indoors, by asking them to be safe and stay home if they have symptoms and are ill. And I think if we all do this together, and if everybody takes responsibility for their space and understands that we're all in this together, I think we actually can navigate an in-person semester and make it through this and actually benefit from those opportunities to learn and share together. But I think everybody needs to be responsible and understand that masking and vaccinating and self-responsibility and self-monitoring and staying home if you're sick are the only ways that this is going to work. If people choose not to do those things and to be irresponsible, then unfortunately there will be risk in those settings. But I think we can do this, and I think Badgers can do a lot. And so I'm going to be optimistic that this is going to work out.
Thanks, Dr. Conway. I'm also very optimistic. I think now is the time to get a vaccine. If you've not yet chosen to do so, now's a great time. And I'd also add, if you have chosen to get vaccinated, I would share with someone your why. At this point, having one additional person get vaccinated because they heard your why is just wonderful. And if you have questions about whether or not to get vaccinated, talk to your healthcare provider, talk to somebody at UHS or a trusted provider, talk to a loved one, someone that you trust, whether that's a friend or family member. And if you are that friend or family member answering those questions, really listen and hear what their concerns may be. And overall, if you hear what Dr. Conway is saying, these vaccines are safe and effective, and they're the reason that we're able to be where we are today. We actually had one more live question pop up, so I want to make sure that we get to this one quickly before I give you two a chance to give some final thoughts. This one is about testing. Jake, if you could speak to this. So for those who are unvaccinated but have no plan to visit campus, for example, they might be dissertators or they might be about to graduate and they have no plan to come to campus, do they still need weekly testing, and or would this put someone at increased risk of exposure?
That's a great question. And the thing that we have to acknowledge is that we're part of this community. Our health and wellness doesn't begin and end at the boundaries of the campus itself. And so most of our time that we're here, we're spending away from the campus, large portions of that. And so we as individuals have responsibilities, members of that community, to protect ourselves and protect others. And so with those things in mind, and actually our own data really over this past period of time has shown that most cases where we've identified positive cases and done the research around the potential origin of those comes from interactions off campus, social interactions in particular. So we just that's really where you're most at risk. And that's why we have also required anybody who's, regardless of their plans to come to campus, if they're a registered student, living in the Madison community or very nearby, you will still need to participate in the testing requirement by coming on campus. And again, all the protocols that we have on campus make it really a much safer place for you to come. And the testing sites will be operating under very strict protocols as well. So it should be a place that you should feel safe to come and get tested. The testing is really important if you're not fully vaccinated. I guess I'd add one other thought too, one other reason for you to consider getting vaccinated if you need additional support for that is if you're vaccinated, you're fully vaccinated, and you should become exposed to somebody who turns out to be positive, you're still going to want to self-monitor to make sure that you don't develop some sort of symptoms, but you won't be required to quarantine. So that's yet another added reason for you to consider doing that.
Thank you. I appreciate that. And I really appreciate what Dr. Conway said earlier about, this is an individual choice and responsibility, but impacts our larger campus community. So we're all in this together, and it's an individual decision, and we've given you the tools to make that decision. And if you need more help making that decision, we're here to listen to that. But this is about all of us coming together to make for a safe, vibrant campus community. So okay, one more question came in. So you two might not get a chance to do some final thoughts, but this is one for Dr. Conway. We just want to make sure we're answering as many live questions as possible. So I'm going to read this as it was submitted. I recently had COVID-19 and might test positive before I travel, even though I am no longer infectious. How can I navigate this? And then, could I get vaccinated when I arrive in the U.S.? And what if I still test positive when I get here? That's a longer one, Dr. Conway. I can do that in a couple parts, but could you please speak to that? If someone recently had COVID-19, they might test positive before they travel, even though they're not infectious. How can they navigate this situation?
Yeah, it's really challenging. I mean, it's unfortunate that people continue to get infected by this, but the rules are the rules, at least at the border and immigration level, and we certainly don't sanction or encourage anybody to provide fraudulent results. So unfortunately, if people are positive and continue to test positive, they're going to need to make some alternative plans and change their travel plans, because they will not be allowed in most circumstances to board a plane and to be able to travel until they do actually clear their infection. And I think people need to understand that even though they're feeling well, there is still the risk that they could still be shedding live virus. Although the testing is quite sensitive and may just be picking up leftover fragments of the virus, there is still a possibility, and there are many cases that have been documented of people that actually shed live virus for some period of time even after they're well. So I think people need to respect the test and understand that that's the reason the testing is being done, to really mitigate risk for those that are on the planes, as well as those that you're going to be around during the course of that travel. Certainly people that have had infection before should absolutely be encouraged to get vaccinated, even if they've recovered from infection. It turns out that the immunity from natural infection, especially if it was a milder infection, isn't really as powerful or as durable as the vaccine generated protection. And so that's the reason that just having the infection doesn't get people off the hook, and really do want to still encourage those people to be vaccinated. My last comment is going to be that this is clearly becoming a disease of the unvaccinated, that 97% of the patients that are getting admitted to the hospital during this most recent Delta wave are unvaccinated individuals, and people that are getting admitted are often getting admitted and just having inadvertently discovered that they actually are infected, but they're getting admitted for other reasons, or they have relatively mild disease, or they're immune compromised, and those are the reasons that we're giving those people additional doses. But this is really becoming a disease of the unvaccinated. The vaccines are what helped us tamp down the very first wave of this virus, and now unfortunately we've got a brand new one with Delta that really is a little bit worse than the very first version we had. So I encourage everybody to get vaccinated, to tell people that you're vaccinated, and encourage others to get vaccinated. These vaccines are safe, they're effective. Yes, they were developed in record time, but they were developed in record time by making the system more efficient, not by cutting corners and jumping over the usual processes. It's just something that when there's an imperative, that it turns out that the pharmaceutical industry, that science, and that the US government can actually get together, collaborate, and make these things more efficient. But nothing was done to shortchange us on the data that we needed to prove that these were as safe and effective as they need to be. So please get vaccinated and encourage everybody else to do so. That's what's going to get us back to being normal Badgers again.
Thank you, Dr. Conway. And I would like to also mention that a lot of the science for the vaccine was actually started here at UW-Madison in the 1990s. So talk about some Badger Pride. Jake, 15 seconds, final thoughts.
Well, thank you, Marlena, for leading us through this discussion and the questions. We hope that people feel better about what they're hearing and know what we need them to do. Again, it's really important that you get vaccinated, and if you haven't, we're ready to do that for you when you arrive. And UHS is here to help and support you through your time here on campus.
Thank you. We're at time. Again, I would like to thank Jake and Dr. Conway for their time and attention this morning. This recording will stay at this link. You can find information, including frequently asked questions, at covidresponse.wisc.edu. And again, I just want to mention to students that we're so excited for you traveling here. For those of you who are arrived on campus or are yet to start your travels, please safe travels. We look forward to seeing you on campus, and be well. Thank you very much.